breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and co-founder, as always, Dr. Glenn Harrison.
Hey,
how's it
how
going,
are you
buddy?
doing?
Good.
Yeah. I see you said you burnt your hand.
I did. I stuck it on the radiator of a tractor that had been running for a while. Not my proudest moment, but
Okay.
I digress. Whatever.
Okay. Well,
Life goes on.
Life goes on. And so does people's lives with Hashimoto's.
Yes. Okay. So this is an interesting one. When we were looking back at stuff that we've done and stuff we haven't done, we've talked about thyroid. We've talked about diabetes. We've talked about all this stuff. And all of a sudden it kind of like went, aha. Like we've never talked about Hashimoto's, and that thing is incredibly common. In fact, I think I had one yesterday. But before we do that, if this is your first time watching, listening to the podcast, please hit like and subscribe and turn on notifications because we're going to continue to roll out new content each and every week. Hopefully we roll out something that's applicable to you. So picture this. You're a patient that comes in. You have extreme fatigue, hair loss, weight gain, difficulty swallowing,
brain fog,
balance issues, muscle weakness. Where are we at? What are you thinking?
I'm thinking some metabolic disorder, but with the brain fog, it's a neuroinflammatory condition.
Right.
In addition to some metabolic disorder.
Yep. Just literally walked in yesterday. This is like how common it is, right?
Yeah.
And inevitably, how it looks usually for me is you go, have you had your thyroid checked? I go, well, yes, I have. And you go, did you bring those thyroid labs in? They're like, yes, I did. And they look and it says TSH and T4. And you go, that's great. That looks great, but that's not a complete picture.
Yeah, there's 2 of 12 pieces. The other 10.
So
true.
What we're talking about here can be with an autoimmune thyroid condition that's called Hashimoto's. Right. And when you have an autoimmune disease like Hashimoto's, you actually make antibodies to enzymes or proteins that help you manufacture and transport thyroid hormone. Accurate?
Yes.
So
just like that. It's that simple.
It's that simple, right?
That's simple. So yeah,
now begs the question, why didn't we test for it? But we'll get into that a minute later.
That'll be another day. So you ran tests on this patient?
We did. We haven't gotten the results back because literally I saw them yesterday. But I'm
pretty confident that it's going to be autoimmunity. So Hashimoto's is it's really an autoimmune disorder, immune system's damaging the thyroid. 2 major markers are, TPO antibodies, if you look on your lab panel, or TBG antibodies. That'll also be on your lab panel. If either one of those, you have elevated antibodies, it is a clinical diagnosis of Hashimoto's. Then, and if it goes on for too long, then your thyroid will get damaged to the extent that you'll need thyroid medication, etc. But even if you go on thyroid medication, the immune system is still having free reign over damaging your thyroid. And not only is your thyroid being damaged and you'll need more and more medication, or that's what tends to happen, but also your immune system is going to take your energy resources to fight yourself.
Yes.
And so then you end up with, it's like no different. The immune system was fighting a tumor in your neck or a cold or a virus. Your immune system doesn't know the difference. And I have this disorder. I have Hashimoto's. I have the TPO autoantibody, and I caught it early. I never really had symptoms, but I tell you, it really made me tighten up my belt to do what I can to try to preserve, so it doesn't does damage to the extent where I do.
I think that you also brought up, like, kind of in a roundabout way, another thing that people might know that they have a thyroid thing, right? But when you said it's predicate, like your immune system can ebb and flow, right? So it can be active and it can be destroying your thyroid, or it can be, kind of dormant and it's not. This is also like if you're a patient that has been diagnosed with clinical like hypothyroidism, but you're always chasing your thyroid dose, like, oh, it's weird because I go from like heart palpitations to like bradycardia, or I go from like thermal regulation. I go from like super, super hot to really, really cold. I go from, if you're always chasing those thyroid symptoms and are always adjusting your dosage on your thyroid medication, your primary care physician is, then you need to consider autoimmunity too.
That's right.
Because based on what your immune system is doing, it can be impacting the amount of thyroid hormone made.
Mm-hmm. Yeah. So there can be higher levels, lower levels, higher levels, lower levels. And then they're trying to prescribe according to this one number, the TSH, catching it. And it doesn't work that way. So, that's how to diagnose it. That's what it is. There's other things like we talked about. Those are common symptoms: fatigue, dry skin, cold intolerance. These are low thyroid symptoms. But hypo symptoms are like 90% of all thyroid symptoms or thyroid disorders. Only barely 10% is hyper. But other uncommon symptoms, and we're looking, and I've never seen this in clinic, or maybe once. Hoarseness of voice. Have you ever seen that clinic?
Yeah. Yesterday.
No way, really?
Yeah.
Okay.
And
difficulty swallowing. There's lots of different reasons for that.
Yeah. This one was like, you can sometimes like, have them extend their head and then use tangential lighting, and you can see their thyroid. And I was like, your thyroid's massive. She's like, I've heard that, but no one can figure out why. I'm like, well, we're going to check.
Yeah. And then risk factors of this, female, any autoimmunity, higher rates of with females, family history of autoimmune disorders. It's another one, especially if your mom had Hashimoto's. If she has a confused immune system that's attacking her thyroid, there's a pretty high probability, or there's a higher probability you'll have it. And again, no one's screening for Hashimoto's. So, a child really doesn't get there's no investigation until there's a symptom.
Right.
And then the symptom is already too late. Well, relatively too late, because the tissue is damaged to the point where you're not making enough hormone. And then when there's not enough hormone, that's when the symptom comes on. So few people have a thyroid symptom just with Hashimoto's. Few. There can be, but those are more non-specific, random inflammatory symptoms that are showing up because it's an autoimmune symptom, not necessarily a thyroid symptom. So those are, and another risk of turning on any autoimmunities if there's enough of an aggressive physical, chemical, or emotional burden. We can blame
any
mom.
Sort of stress.
Yeah,
right?
We can blame mom to turn on autoimmunity sometimes, or develop autoimmunity. Sometimes we can blame what went on in our life in the last 6 months.
Right. Could be childbirth, could be divorce, whatever.
That's right. Yeah. Yeah. Bankruptcies and all that stuff. So diagnosing, we talked about proper thyroid panel. There's 12 markers. There's 12 markers to know the whole story of the thyroid. Conventional medicine does 1, 2. I see a lot of 2 markers now. What do you see? Years ago, I'd only see 1.
T4. Yeah.
Yeah. Now we're seeing 2 or even 3, but there's 12 to know the whole story. And I know you run that on. If you're doing any lab work, it's just standard.
I run it on everybody.
Yeah. Then and I know you catch a lot of Hashimoto's in your office. I catch a lot of Hashimoto's just because we're testing.
Yeah. And it's, so you might have like subclinical, euthyroid Hashimoto's, which is like you have the antibodies, but your thyroid hormones are all normal. Right. And honestly, that's kind of a good place to catch it.
Yeah. I call it like type, like stage 1. You just have antibodies. Stage 2, there's enough damage, your TSH goes up. And then stage 3, you also have true low thyroid hormone and symptoms. So what can you do? What can you do? What do you think you're going to be? Well, if this individual has Hashimoto's, what do you think is going to be direction? Of course, everybody's different.
Immune modulating, right? So we're going to do things like, obviously you want to make sure that you're controlling stress if you can. You are going to help with immune system modulation through things like, vitamin D, some fatty acids, stuff like that. There's different things that help your thyroid, like physiology. So things like selenium, that's been shown to be beneficial. Well, mainly what I would do is just go see you or me. If you already have it and you're like, I just want to like make sure that I know what I'm doing. Now, obviously, if you're having like, if it's full blown like Hashimoto's hypothyroidism, probably going to want to maybe look at getting some
replacement hormone.
Yeah. Some exogenous thyroid hormones.
But the numbers will tell you if it's too low or not. or it's not to that point. And, you know, selenium is a big one.
Yep.
Omegas are big. Vitamin D are big. There's a fair bit of research around turmeric to just try to, you know, cool down the inflammatory response. But there's a lot of those.
All those bioflavonoids like, you know, turmeric, resveratrol, those both help with you know, systemic inflammation.
Yeah. And then, you know, you can start looking at foods and things like that. And we've talked about this with cross reactivity, so we're not going to go into all of the cross react. Right? Didn't we do that? I think we talked molecular mimicry and gluten and things like that. I believe we did podcasts on all of this. But there are some foods that tend to be problematic, cross reactive, and in that other podcast, it's just where your immune system can confuse. If your immune system doesn't like your thyroid, there are certain foods that can look like your thyroid. Doesn't mean it does. You got to test to know. And, you know, you can Google Hashimoto's diets and all this stuff, and you're going to see common themes. The thing is, it's hard to avoid these foods unless you're 100% confident you know. Yeah. Right? It's very, very hard. So, you know, we're going to rattle off a few here, but I highly recommend get it tested. Know if you're truly reacting to it, because you're going to hate life just to do it just because. And a lot of times you do it, you remove these foods. It doesn't necessarily mean you're going to have some amazing symptom lift. And a lot of times controlling your immune system with certain pieces of certain efforts aren't going to show a symptom, but you'll see the improvement in physiology and blood work. And that's a hard thing to be adhering to. If you don't, it's not cause and effect or effort and outcome. So, you know, some of the big ones are, you know, dairy, gluten. Those are two big ones in the world of autoimmunity, specifically Hashimoto's. So, you know, there's we were talking about some other things, and if you have all these symptoms, so either someone is listening to this and they're, oh, well, I have Hashimoto's, great, because they're searching for Hashimoto's and they know what Hashimoto's is or a little bit, or they hear the doctor, the doctor says, oh, these antibodies really don't matter. You know, these are just antibodies. Hashimoto's, there's really nothing you can do with it. It really doesn't matter. We just look at TSH. No, Hashimoto's does matter. Autoimmunity to the thyroid does matter, because if you have one autoimmune disorder, there's a 50 to 60% likelihood you're going to develop another, and they start to stack. So if you have one, your immune system is wound up. It's ready to go. It's marking one tissue as bad. What's the next one going to be? So take it serious. Take it as an autoimmune seriousness. And there's lots of terrible autoimmunities. You see lots like MS. You've done podcasts on MS. And there's a million other ones, rheumatoid arthritis and ankylosing spondylitis, celiac, Crohn's. Actually, didn't we come across Hashimoto's and celiac are closely associated? The relative consistency, if you have one, there's a higher rate you have the other. I can't remember what it was. Do you remember?
I can't, but I think that you're correct.
Yeah, I can't remember what it is. So now, please, if you're listening to this and you have Hashimoto's, doesn't mean you have celiac, but the probability of developing another autoimmune condition is very, very, very high. So,
well, on top of that, can you imagine? I don't know if I could know and not do anything about it. You know, it's like, oh, you got this autoimmune disease. We're just going to wait until it gets bad enough where we can give you something.
Yeah.
Like, that's it?
Because that's what it is. It's a waiting game, right?
Yeah. Like, oh, well, as soon as your eyebrows start falling out, let us know. Like, what?
Yeah.
That's it?
And what else is going to get attacked in the meantime?
Yeah. What are you waiting for?
Excuse me. I was doing a presentation this years ago, and I did lots of presentations, and I think I talked about this. This lady was sitting at the back of the room. We've probably talked about this story somewhere on a podcast, and I was talking about thyroid. It was a thyroid presentation, talking lots about Hashimoto's and what it is and everything, tests, and then there was one part of the presentation I mentioned this: if you have one autoimmunity, there's a higher likelihood, 50 to 60% chance you have another. And then if you have a second one, your risk for a third one even goes higher. And I finished the presentation. She was sitting at the back of the room and she was sobbing. Everybody left the presentation. They chatted and left, and I was packing up my things. And so I was like, oh, what did I say? So I went and said hi to her and to see what was going on. And then she started to reveal it. So this lady, she was diagnosed with, I think it was a year prior to when I met her. A year ago, she was diagnosed with celiac disease because she had a lot of digestive issues. And then she went on, her meds and changed her diet. And then it was 6 months later that she was diagnosed with ulcerative colitis. But it was so bad already. It got so bad from the 6 month at the time I saw her. She had to have a bunch of her intestine removed, and she had a bag. And then just recently, like it was 2 weeks before she came in, she was diagnosed with Hashimoto's. And then she said, her question was, Dr. Harrison, what you said, do you think this could have been prevented? He said, I don't know. But you were in a very, very risky situation, a year ago. However, it was turned on. So these things do happen, I guess. And take care of yourself. You only have one set of tissues. You don't have spare ones. And investigate it, and don't just accept elevated TPO or TBG antibodies and Hashimoto's is just a thing.
Yeah, find someone to help you, right?
That's right. And if you're in Minnesota, go see Dr. Kolby.
Huckleberry. You're anywhere in the Western states, Dr. Glenn's well worth the drive. Yeah. If you guys would like to get a hold of us, our contact information is info@brainstormingwiththedocs.com. You can get on our websites. Mine is northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. He's got a ton of information on there. We do have a link to some common supplements that we use. Maybe we put in the bioflavonoids, whatever.
Yeah.
If you guys would like access to that, it's down there. And again, hit like and subscribe, turn on notifications. We're going to continue to roll out content bi-weekly, every 2-3 weeks. And you never know when that content might be useful to you. So till next time, I guess.
Right. That's good.
Stay on your diet. Take care of that thyroid, my man.
For sure. All right. Talk to you next day.
All right. Bye.